and we feel this is woefully inadequate. There are two kinds of research that need to be done. Basic science research that would look at biological mechanisms for hepatitis B vaccine-induced injury or death, which would include looking at what happens at the cellular and molecular level in the human body after this vaccine is given. The other concern is that this vaccine is often given with other vaccines. And part of my Freedom of Information Act request to the CDC and FDA goes over the different studies that we would like to see that hopefully were done before this vaccine was recommended in 1991 for universal use in all children, particularly newborns. And that would include studies, include such things as how many children were involved in these studies, the time periods for follow-up of vaccine adverse events. In the manufacturer's product insert, they list 4 to 5 day follow-up for studies that were used to license this vaccine, and yet the reactions we're seeing are taking sometimes longer than 4 to 5 days to occur. So have we missed in those studies all of the people that testified here today? How good are these studies? Did they include racial diversity of infants and children enrolled in them, particularly in light of what Dr. Dunbar said? If we have genetic predisposition here, if there are certain genotypes who are more susceptible to reacting to this vaccine than others, and we've only done these studies in certain genetic populations, then we don't really know what's going on. And when we give this vaccine and mandate it, and we haven't done the studies prior, it is an experiment. And we can't afford to do that. And so I think these FOIA requests are very important to take a look at not only how was this vaccine licensed and policy made for it, but also, is the system that we use good enough, or should we be raising these standards?
One of the other questions that's come up in this hearing and also prior to this hearing, it's a review of the 86 law and the access to compensation through that law for those who have some type of vaccine-related adverse reaction. You were involved in some of that, the development of that legislation, and I guess have monitored, Ms. Fisher.
Yes.
How do you feel about how that's working?
We are extremely disappointed in how this compensation program is being implemented. In fact, it's tragic. Those of us who came to the table in good faith in the early 1980s to work with Congress and work with the vaccine manufacturers and work with the American Academy of Pediatrics feel like we have been betrayed because 3 out of 4 children are being turned away from this system, and because all the work we did to, for example, set up the table of compensable events for DPT vaccine injury and death so that this system wouldn't be like a trial and you wouldn't have to show the same kind of proof and it wouldn't be traumatic and it wouldn't be expensive. HHS came in after that law was passed, and they came in and they gutted it. They gutted the provisions to have compensation for DPT vaccine injuries. And there's almost nothing that's now presumed to be associated with DPT vaccine. And we were promised that this would be a fair and expedited system, that it would be a fair alternative to the tort system. And we feel like we've been betrayed. And the fact that there's $1 billion in the trust fund is a disgrace, because there are children out there who need that money, because they have done what they were told to do by doctors and public health officials, and they're out there coping and suffering with vaccine injuries, and nobody's helping them, because all the resources of HHS and Justice are brought against these plaintiffs. Justice represents Secretary Shalala in these cases, and it's not a level playing field. And I think we absolutely oppose the using of any of that $1 billion for anything other than compensating these children. The money for these studies needs to come out of the billions of dollars that's being given to HHS to fund new vaccine development and to set up tracking systems to track children in order to enforce vaccination and to promote vaccination. We have got to do a better job of looking at the existing vaccines we have before we put new vaccines on the market. And we've got to do a better job of taking care of the children who pay the price, who are the casualties of our public health programs. Our children deserve no less. I thank you very much for supporting the ethical concept of informed consent. I think this is really, really important because, as you know, as a parent, you love your child more than anyone ever could. And when a child dies from a disease or from a vaccine or is hurt, it's you, it's the mother and the father who lives with the consequences of that. And that's why the ethical principle of informed consent that is applied to every other medical procedure in this country that carries a risk of injury or death is so important to be also applied to vaccination. We're not calling for the elimination of vaccine laws. What we're calling for is flexibility within the laws, a humane application of the laws. We're asking for the right to exercise conscientious belief exemption if we believe our children are at great risk of having a reaction. I come from a family of serious autoimmune disorders. My mother has lupus. I have one child who has reacted and has had disabilities from a vaccination. How can the state possibly ask me to take a risk with a vaccine like this one, when I know that my children could either die or have autoimmune disorders from getting this vaccine? Parents have got to have the right to have the information and then make informed decisions for their children. Every parent wants their child to be healthy. They don't want their child to die from a disease or a vaccine. We've got to give parents more credit. We've got to believe in them. They love their children.
You had advocated several specific recommendations. One was licensing standards, increased licensing standards. Is that correct?
That's right.
And how? What are you talking about there specifically?
Well, the reason I filed the FOIAs, very detailed FOIAs with CDC and FDA on this, is because I was hoping that we would, I don't know the answer to that question, and I was hoping that the committee would help us get those answers and do a review of the licensing procedures and of the policymaking procedures.
The other item you recommended was non-government studies, but if it's a recommendation to us, it's going to involve government monies, and we have a pretty have a pretty complex manner of funding studies that was made that way to keep the studies independent and from outside undue influence. How can we have a non-governmental study financed by government? Do you have
I understand there are,
specific-
I am not real knowledgeable on different.
and then get an independent study? Is that, and that's, I think you're questioning the independence of these studies, but
Right.
I don't see how we can accomplish that recommendation since it's government funding the studies.
I understand
Unless
that,
you have some protection and barriers.
right. I'm not knowledgeable about the grant structure at NIH, for example, but I understand there are some grants which are more independent. They're given to scientists, and they're more independent from control by the CDC or by NIH. I don't know exactly what they're called, but I understand that there are grants available where the problem though is who's going to be on the peer review committee? Bonnie Dunbar has applied twice for an NIH grant to look at genetic predisposition to hepatitis B vaccine reactions. I don't know why she was turned down. She's been a vaccine developer for 26 years. She knows methodology. She knows what she's doing. You don't see these grants being given out to scientists who want to look at adverse effects. The grants are given out to develop new vaccines and to look at efficacy of vaccines, but not to look at clinical reports of adverse events. And so I don't have all the answers. I only know that the public is very suspicious of having industry and government be in total control of these scientific studies. And so if there was a way to get the funding and then have some autonomy, so that yes, of course, to publish, you have to be peer reviewed. You have to go through a peer review process. So that's, I don't have the answers, but I'd be happy to work with the committee to find one.
Thank you. Well, I'd like to thank both of our panelists and everyone who participated today, our various witnesses, for their participation. As I said, we will leave the record open for 30 days, which I've never extended the record that long, but since there's so much interest in this subject, we will accommodate additional input for the record, and anyone interested should contact the Subcommittee on Criminal Justice, Drug Policy, and Human Resources with their submission. Without objection, that is so ordered. There being no further business before the subcommittee, I will call this meeting adjourned